Lots of confusion still about the AstraZeneca jab. Each day we seem to learn something new that I don't know clears things up.
No, I think that we are a bit clod-hopping in our approach towards the vaccines. We're not spinning and being flexible as I think we should be when we've got such poor supply. Even as it ramps up, it's still not good enough. And vaccine hesitancy, as you saw, as people saw in Victoria, disappears when you've got an outbreak, and it's disappearing in New South Wales as well. And there are various strategies that could help here, but don't seem to be employed. So one is get your Astra earlier to get covered, which is fine. And sorry, Michael, I couldn't join you in getting the second dose. I had my second dose on Sunday at 8.5 weeks, and because I just want to be covered, and that's a good thing to do, and just get that second dose in and get covered. 6 weeks might be a little bit early, but that's up to you and your doctor to decide. There are various other strategies. We still haven't approved a mixed dose strategy, so where you could have Astra followed by Pfizer, which gives you almost the equivalent of having 2 Pfizers. For example, what you could do, and it's up to people's choice, is say to people under 60, look, it's up to you and your doctor whether or not you have your first dose of Astra, but what we will give you at 3 or 4 weeks is this Pfizer as a second dose. And that will boost immunity quite considerably when you've got the epidemic running in a place like New South Wales. The other thing that you could do, for example, is in states where you don't have COVID running, extend the second dose of Pfizer to 6 or 8 weeks, which is probably just as effective, if not maybe a little bit more effective, and that will free up doses for where you've got outbreaks like in New South Wales to free more Pfizer up there. We're not flexing how we do things. We're not being flexible. And that's also reflected, by the way, in New South Wales, where they're not being that flexible in terms of how they're approaching this outbreak.
Okay, let's pick up on the outbreak. What's your view about the scale now and where it could go in the next few days, if not weeks?
It could go off, unfortunately. It's growing exponentially. I mean, in this whole pandemic, I just want to be proved wrong, and I would love to be proved wrong. But last night on 7:30, we had modellers from the Burnet Institute and also data journalist Juliette O'Brien on saying the same thing. If the settings don't change, and they are what they are at the moment, then it seems that they're going to go through to Friday. So every day can be nearly a week at the other end. So every single day you wait. And if it doesn't change, based on what happened in Victoria in the second wave, this could go on till Christmas.
Really?
Yes. It could go on for 2-3 months, or it could get out of control altogether. So this is really serious in New South Wales. It's at a level which nobody has seen before in Australia, and they need to go to stage 4 lockdown now, according to Brendan Crabb and the people at the Burnet Institute, but Tony Blakely is saying the same thing. So epidemiologists are saying this is just not enough. People in New South Wales don't know what's essential retail, what's not, who are essential workers, who's not. They're allowed to travel for 10 kilometres for exercise, etc., etc., etc. It is not a proper lockdown.
Okay, going to Christmas is, 5 months? And I mean, worst case scenario, of course, but that'd take it longer than Victoria's second wave shutdown last year.
Absolutely. And remember, that was with a version of the Wuhan virus. Yeah. And this one is 3 times as infectious.
When you're comparing, though, what went on in Victoria and New South Wales, how much do you factor in that there were no vaccinations when Victoria went through what we were going through? And while vaccinations are still low, that number is creeping up pretty quickly. So surely that would mean New South Wales would be ahead of the game when you're comparing the like for like.
No, unfortunately. We're only, I don't know, I haven't looked recently.
It's 11%, 2 dose rate.
So just in double figures. We've got to be at 60-odd% to see a significant impact. And it's going to be a long, long time before we're at 60% coverage of 2 doses. A long time.
So how do we encourage more people to get vaccinated? And we turn our attention, of course, to those 2 ads, the arm yourself happy ad and the other not so happy ad.
The only thing that we don't need ads right now. I mean, we did a little while ago when we had no COVID running anywhere in the country and people were saying, well, I'm just going to hang on. That's when we needed ads, and that's when we had doctors walking around with stethoscopes on around their necks thinking that was actually going to make a difference. I mean, it was a joke. We don't need ads now. Hesitancy's disappeared. As soon as Pfizer becomes available in large numbers, there's going to be queues around the corner. When you need ads is towards the end of this year to mop up the last hesitant people. But we can in Australia get to 80 or 90%. We're not that. We're a good vaccination nation. People want to get the vaccine. They're going to bear their arms. And that's why we just need to be flexible about the strategies. And we're just not seeing that flexibility, just as we've not seen a lot of flexibility at bureaucratic level at a national level.
Yeah, gee, thanks, Norman. Listen, we speak to you every week, but mate, I can really sense your frustration this morning, certainly as a Sydney resident.
Yeah, and I felt it for Victoria as well. I mean, it's just, these things are happening. It's going to get worse. The Delta is just a step along the way. The next variant will be worse than Delta. And we've just got to be flexible about our policies and also implement what we know is epidemiologically right. And that's not happening in New South Wales, and it did in Victoria a few weeks ago.
Yeah.
Norman Swan, thank you for joining us.
Well done on making your informed choice on your second dose. I still feel like a jilted lover, but that's okay.
Yeah, we'll make up.
We'll make up.